A lot of people ask, how do my joints get out of place, Dr. Mack, or why am I misaligned? And the reality is that your joints don't go in and out of place. They're still in place. They're just really stiff and restricted. And what happens with that is when we have an injury, we have inflammation, these joints become stiff and they become less mobile. And that's important because that causes muscles to tighten up around them. So now you have these muscles that get really tight, that start creating inflammation. And this inflammation sensitizes our pain nerves, so we become more sensitive to pain, we become more in pain. What's additionally happening is that all these little receptors which are little sensors that live in our joints and muscles that respond to movement, they become less active because we're not moving anymore. So this decreased activity and this decreased stimulation of receptors decreases information to our brain. So as we get decreased information to our brain from really restricted moving joints and muscles, our brain starts to decline in these areas. And what it does is it also starts to change its mapping. So it has a map of our body. The brain controls the body, we all know that. But the body sends information to the brain through our spine that helps the brain understand what's going on down here. And what it does when it receives that information is it actually stimulates it, makes it healthier. So we look at having a healthy spine actually creates a healthy brain because the brain, when it receives stimulation, is able to make more proteins or more connections to other brain cells, more pathways, more connections. And the more connections we have in the brain, the healthier our brain is. So the brain starts to change its map. So it starts to remap. And when it remaps for pain, because pain now is the predominant signal that's coming to the brain. So the brain is no longer receiving information about joint position or muscle tension or muscle position and all of these aspects. So it says, gosh, I need something to understand what's going on in there. So it actually uses our pain nerves, type C nociceptive pain nerves, to understand what's going on. So it remaps for pain. So now when we move and do things, this is where chronic pain comes in, we start to experience pain for normal moving activities that would normally just be not felt at all. So as the brain remaps, it enlarges the map. The map gets bigger, so it expands this map over time because we're not getting information very well. It says, well, I need to try to use the neighbors to get the information. So your area of pain starts to get bigger. And that area gets bigger and bigger. So now where you had lower back pain on the right side, now it's maybe on both sides. And now maybe it's a little higher. Now maybe you're feeling it in your hips. Now maybe you have some knee pain. Now maybe even you're starting to get some, stiffness and postural changes of your upper thoracic or your upper body and even into your neck. And so these things start to build off each other, and that becomes a really slippery slope for people. And there's a lot of people that we see. So we see these complex conditions, and a lot of these start from one thing. And it doesn't, it matters because we have to get back to this source. And if we can improve mobility, which is really what we're trying to do, trying to improve mobility because we want to improve sensory information to the brain. We want to improve this receptor feedback to the brain, and these receptors then reshape the brain. And now the brain's map goes back to a normal mapping, and the chronic pain starts to subside because now we don't feel pain with movement. Now the inflammation goes away. Now this map gets smaller. And now the brain is able to get stimulated the way that it really requires, and it becomes really happy. And so now the brain says, oh, I can coordinate that area better now because now we have good information up through the healthy pathways that aren't painful anymore, the movement pathways, and those pathways in turn come right back down to coordinate and heal and restore function. And that's how we fix back pain. And that's how we fix neck pain or shoulder pain or knee pain or whatever it might be, is if it's functional, meaning it's not, a tumor or some kind of big growth or some kind of cartilage tear or something like that. If it's functional, meaning it's a mobility problem, which the majority are, then we can restore that. But it takes a little time. And when we do the right thing, over time, we create these new connections properly, restore those connections between the body and brain, and the brain gets healthy and it coordinates the body. And that's how we fix things with chiropractic neurology.